Hi, this is the Chapter 1 lecture video. Before we get started, I just wanted to let you know what the purpose of these quick lecture videos will be. Basically, I am introducing you to the concepts that you'll read about in the chapter, and in certain cases going a bit beyond or connecting some current events. The hope is that by listening to the podcast first, and then watching the lecture video, you'll be more primed to do the reading because this is a rather dense textbook, but this should help. So the title of Chapter 1 is The Challenge of Healthcare Delivery and Health Policy. It is very much an introductory chapter. It first introduces us to the concepts of health and the importance of health to Americans. Now, in one chapter, you certainly can't cover how health and healthcare has changed over the centuries, how many the medical advances have been, but there is a quick introduction to that. What becomes interesting and important is this bottom bullet here, because we very much have contrasting missions for our healthcare system. Look up, if you're not familiar with the word, what altruistic means. Okay, so we see here altruistic goals plus a huge industry. And you probably can guess just by looking at that contrast that what we're referring to here is the fact that people go into medicine and into healthcare in order to help others. That is by far the major draw of these careers. And yet this is an industry in this country, a profit generating industry as well. So many of the issues and concerns about our healthcare system have to do with that clash. Take a look also at the percentage of the economy that healthcare generates. That is actually huge. 20% of the economy and 11% of jobs. Recently, there was an article on the downturn in the gross domestic product that has occurred during COVID-19. And they attributed this very much to the decrease in the number of elective procedures, since many healthcare facilities, practices have cut off elective procedures and are focusing solely on urgent and emergent care. So our healthcare system can be defined in many different ways, and you can see here by just a quick skim that many of these definitions or defining characteristics are not a good thing. Okay, they actually indicate problems with our healthcare system. So we look at disorganization, lack of coordination. Okay, that can cause problems in terms of quality care, in terms of patient safety, in terms of satisfaction with care for sure. Many actors working independently, you may have heard the term silos, that people work in their silo, whether that's their specialty, whether that's their facility. There's not a lot of interconnectedness and coordination. There's been a haphazard evolution of our healthcare system, and you've probably been made aware of this, but you'll read more about this semester. And the driving force does seem to be the profit, does seem to be economics. So since this is a profit-based system, quite often the design does not appear to be logical. We have another clash between maintaining versus restoring health. Much of our dollars, most of our dollars are spent on sick care rather than well care. And we have huge problems with disparities in health and health care, with an economic and social determinants of health coming into play. So we'll be digging into all of these bullets during this semester. Now, more defining characteristics are listed here. I'll let you read through them. organizations, professionals, medical technology, huge one, number 4, and that's the tension between the free market and government control. And there's quite a lot of talk about that now with the election around the corner and the two parties presenting very differing views on what healthcare should look like. There's also a very dysfunctional payment system in that providers are often rewarded for giving more care, but not necessarily better care. So those issues and concerns lead to things like we need to improve quality. We need to improve access and coverage. We need to slow the growth of healthcare costs for sure. And to do that, we definitely need to encourage healthy behavior. We need to improve the public health system, and never has this been more clear than in 2020. We need to improve coordination, transparency, accountability, and certainly address these disparities, these inequalities in access and outcomes. The key stakeholders influencing the healthcare system are defined and discussed in Chapter 1. So you'll see here consumers, providers, employers, insurers, and public policymakers. And what is interesting is that these are all stakeholders, but they have often different interests. So everyone is working for their interests, which are at times not in the best interest of others. So you can see here, as a consumer, the individual should be at the center of the healthcare system, but they're often bystanders even in their own care. We know that they can be influential when they are dissatisfied. We also know that consumers need to become more empowered and activated to take care of their own health, and that includes healthy behaviors. Consumers want access, as they should, to quality health care. Providers, of course, want to work with the latest medical advances and technology. They want to keep people healthy, but they work inside of this huge business that is the healthcare system. So they are pressured to contain costs, accept lower fees, provide quality and better patient experiences while also maintaining lower costs. They would like to be less encumbered by all the complexities of our healthcare system. Employers have a stake in this as well, because healthcare takes a piece of their profit. So employers would like to see healthcare costs lower. They also want their employees to be healthy, of course, not only for altruistic reasons, but also because that would increase productivity. Insurers are the mediators. They, in a way, are the middle guys. They mediate between payers, providers, and consumers, and often set rules about what you're eligible for being reimbursed for, and the payment rates as well. So they are in the middle, and they face pressure from all the stakeholders. But they're influential in this position at causing change or impacting change. Public policymakers are so quite different in their points of view for sure. So their vision for a good healthcare system differs depending on party, depending on philosophy as well. They do want to slow the costs of healthcare because that impacts the entire nation. And of course, they want state-of-the-art medical care and prevention measures. Now, your textbook is organized. We will not cover all of the chapters in the textbook. We cover most of it. The chapters that have been left out are covered in other courses that you take as part of the Health Services Management program. But this is a great book. It's actually one of the most widely used books in health healthcare system studies. So part 1 is healthcare delivery, part 2 keeping Americans healthy, part 3 medical care delivery, and part 4 the futures. After you listen to this or watch this video, what you should do next is read chapter 1. Make sure to take notes, to annotate, to think about the information you're presented with, to look up definitions. The more you become involved in your reading, the better you'll do on the quizzes. The quizzes are challenging, and you need to understand the material before taking the quizzes.